Cancer is a genetic perturbation of cells, in this case in the lining of the bowel, such that they collect the capacity to grow in an uncontrolled fashion, and they invade through the bowel wall. They then become malignant, and that's what we know as a bowel cancer. Bowel cancer presents with a number of symptoms. Patients come in with symptoms that are very common, such as a little bit of rectal bleeding. That's a primary symptom of bowel cancer. That's a worry. Other things we think about are a change in bowel habit. If you have a change, you have an increased frequency, it's changes in its form, or pain, perhaps, particularly if it's associated with a change in bowel habit. They're the main things. And then for more severe or more advanced cancers, you might be anemic, you might be losing weight, you might have lost appetite. They're usually symptoms that would be associated with more advanced disease.